What happens when it is not the disease, the pathology, that makes us ill, but the thought itself? The human mind is an exceptionally complex biological system, a sophisticated adaptive mechanism, possessing an extraordinary capacity. It is able to amplify the threshold of our perception, noticing minute bodily signals, somatic sensations, that would otherwise remain entirely insignificant to a non-vigilant observer, and subsequently magnify them to an extent that distorts our lives and our perception of reality. Today, we address two seemingly contradictory yet deeply interconnected neuropsychological phenomena: hypochondria, or the currently used professional term, health anxiety, and the placebo effect. We seek to avoid one, while we hope for miracles from the other, yet both originate from the very same cognitive and neural mechanisms within our minds. The scientific definition of health anxiety, or hypochondria. Hypochondria, or the more precise term used today, health anxiety, is a psychiatric disorder. This is a condition characterized by persistent, dysfunctional, and irrational health-related fear that resists logical evidence and is not alleviated even by reassuring medical test results. This goes beyond mere general concern. It involves constant, hypersensitive monitoring of the body known as hypervigilance. The individual struggling with health anxiety exhibits heightened interoception. Every minor prick, slight muscle tension, or headache immediately raises suspicion of a pathology. What remains unnoticed or insignificant as a somatic signal to others, such as normal intestinal peristalsis, becomes an undeniable alarm signal for the health-anxious individual. It is crucial to state, this is not a matter of weakness or capriciousness. The mind automatically focuses on the worst, catastrophizing outcome, a survival mechanism gone awry, and thereby generates a continuous state of chronic stress. The neurobiological background. What occurs in the brain? Complex biological and psychological mechanisms operate beneath the surface of health anxiety. Dysregulation of the limbic system. The limbic system, as the emotional center of our brain, plays a pivotal role in regulating fear and anxiety, fundamentally dictating our defensive reactions. Activation of this system, which includes the amygdala, causes the body to generate the physiological responses characteristic of anxiety: an elevated heart rate, tachycardia, superficial, rapid breathing, hyperventilation, and increased muscle tension. This overactivation of the sympathetic nervous system creates the amplified volume effect for bodily sensations. As a result, even normal, insignificant somatic feelings are processed as potential threats. Negative predictive thinking, catastrophizing. The brain is prone to concentrate on the worst outcome through a cognitive distortion, specifically an attentional bias towards perceived danger. In the event of a harmless headache, the automatic thought schema immediately raises the possibility of a cerebral tumor. A simple chest prick instantaneously raises the suspicion of myocardial infarction. This pattern is not mere fantasy but a learned neural pathway that originally served, from an evolutionary perspective, to protect against potential dangers, but in its modern form, it induces continuous, maladaptive stress. The risk to quality of life. Why is this dangerous? Health anxiety is not directly life-threatening, but it systematically erodes the individual's quality of life and functional capability. Perpetual self-monitoring and healthcare seeking, or doctor shopping. The affected individual frequently consults the healthcare system, constantly demanding examinations, seeking reassurance for their symptoms. Negative results only provide transient relief, and subsequently, the anxiety finds a new focus, a new somatic symptom. This persistent search functions as a maintenance mechanism for the anxiety itself. Dr. Google and the nocebo spiral. The internet, as a diagnostic tool, can become a trap for the nocebo effect. Searching for a harmless symptom often reveals a list of severe, rare diseases. This initiates a self-perpetuating panic cycle. The anxious thought triggers physiological symptoms, for instance, muscle spasms or gastrointestinal tension, and the bodily symptom, in turn, reinforces the negative thought about the illness, forming a psychosomatic vicious cycle. Psychosocial constriction. Anxiety controls life. Avoidance strategies develop. The individual avoids exercise, specific foods, or social situations to prevent the emergence of anxiety-induced symptoms. The functional behavioral repertoire is significantly reduced. Ultimately, it is not the presumed disease but the fear, the phobic avoidance, that governs life, which can lead to severe social isolation. From nocebo to placebo, the two poles of thought. If anxiety and negative expectation, the nocebo effect, are capable of generating real physical symptoms, then the question logically arises: is positive expectation, faith, and trust capable of mitigating symptoms as well? The answer is the placebo effect. This phenomenon describes the improvement occurring without an actual pharmacological agent, which is activated in the brain by expectations, conditioning, and the conditioned reflex. Hypochondria and the placebo are, in reality, two sides of the nocebo effect and the placebo effect. Fear, the nocebo, and belief, the placebo, utilize the same endogenous opioid and dopaminergic mechanisms in the brain, but they elicit an opposing, antagonistic effect concerning the outcome. Through this principle, we can understand the foundations of psychosomatic healing. From here begins the scientifically most exciting part of the narrative, in which we will detail the neural pathways of the placebo effect in the subsequent segments. The psychophysiology of the placebo effect. The word placebo originates from Latin, etymologically carrying the meaning, "I shall please." Within the context of modern medicine, the placebo can be defined as a therapeutic intervention that lacks a specific pharmacological agent, yet still elicits measurable and positive physiological changes in the patient. This is not merely a psychological effect. The subjective expectancy, verahatas, belief, and trust placed in the therapeutic context initiate genuine neurobiological responses. Research demonstrates that the placebo reaction is capable of inducing real analgesic effects, for instance, pain relief, via the release of endogenous opioids, influencing the immune response, and even modifying the hormonal balance of the endocrine system. This constitutes clear evidence of the interoperational mechanism between the body and the mind. The background mechanisms of the placebo, neurotransmitters, and conditioning. The action mechanism of the placebo can be categorized into two main groups: neurochemical release and cognitive conditioning. Activation of endogenous neurotransmitters. Upon the administration or ritual of the placebo, the brain releases key neurotransmitters. The activation of dopamine, the substance responsible for reward and motivation, is linked to the positive expectation of healing, while the release of endorphins, endogenous opioids, is responsible for inhibiting the pain-sensing pathways, known as nociception. These internal biochemicals are the body's natural analgesics. The mind is therefore capable of engaging the same biochemical mechanisms that an actual, active pharmacological agent would. Expectancy and classical conditioning. Cognitive expectations and classical conditioning play a critical role in the placebo response. The mind learns that certain contextual factors, or situational factors, such as the color of the tablet, the stringency of the intervention, and the physician's authority and words, signal healing. This is the fundamental principle of conditioned learning. Neutral stimuli, the placebo, trigger a conditioned reflex due to prior experiences or social conventions, resulting in the therapeutic effect. Individual differences and subjective experience. It is important to note that the efficacy of the placebo effect shows significant variability among individuals. The effect is influenced by the patient's personality structure, prior treatment experiences, the quality of the therapeutic alliance between the patient and the physician, and the level of anxiety. This individual difference emphasizes that the placebo is not a universal phenomenon, but one dependent on psychosocial factors. The ethical risks and limitations of the placebo. The placebo should not be regarded as a holistic panacea but as a consciously applicable neurobiological tool. Clinical utility. When consciously applied, it can aid in alleviating illness awareness, reducing anxiety, anxiolysis, and complementing fundamental therapeutic intervention, especially in cases of subjective symptoms such as pain or fatigue. Ethical limitations and hazards. In patients struggling with severe, objective physical pathology, positive expectation alone is insufficient. Ethically critical application occurs when the administration of a placebo causes diagnostic delay, or is based on the deception of the patient, a falsehood, which severely undermines the principle of informed consent and the physician-patient trust relationship. Relation to health anxiety. In cases of hypochondria, the negative expectation, the nocebo effect, reinforces symptoms within a cognitive spiral. The placebo effect, the activation of positive expectation can be the exact opposite, eliciting an adaptive neural response for the functional attenuation of fear. This positive expectancy actively works to inhibit the maladaptive fear pathways. Diagnostic criteria for health anxiety. The recognition of health anxiety is crucial from the perspective of differential diagnosis. Typical clinical signs. This involves persistent, excessive worry about a severe, undiagnosed illness. Characteristic features include abnormal somatic monitoring, that is, the excessive, hypersensitive observation of bodily sensations. Compulsive physician visits, doctor shopping, and repeated examinations are frequent for the purpose of seeking reassurance. A critical criterion is that negative medical diagnoses provide only transient relief, failing to resolve the underlying anxiety problem. Self-assessment questions for recognizing the cognitive pattern. The first step of metacognitive intervention is self-diagnosis. Do I frequently attribute a pathological significance to a harmless somatic sensation in my body? For instance, muscle tension? Is my quality of life genuinely restricted by my symptoms, or is it the chronic fear of illness that controls my daily life? These questions help assess whether the anxiety response given to bodily symptoms is normal or already pathological in scale. Intervention strategies and therapy. Health anxiety is controllable. Therapeutic protocols focus on altering cognitive and behavioral mechanisms. Foundations of Cognitive Behavioral Therapy, CBT. Attentional redirection, attenuation actively diverting concentration away from somatic symptoms towards other, functional activities. Symptom journaling, objective recording of symptoms and the emotional states preceding them, which helps in recognizing the causal patterns between cognitive distortions and anxiety. Correction of catastrophizing thoughts, conscious identification and reality testing of negative predictive thinking. Breaking the panic cycle, applying relaxation techniques and breathing exercises that increase parasympathetic activity during acute anxiety to reduce somatic symptoms. Need for professional intervention. If the individual's functional deterioration is significant, avoidance behavior constricts their life, and the anxiety is constant and uncontrollable, the involvement of a psychologist or psychiatrist is essential. Pharmacotherapy, utilizing agents such as SSRIs, aims to modulate underlying neurochemical imbalances. Cognitive behavioral therapy, CBT, the mastery of relaxation techniques, and, where indicated, pharmacotherapy offer a solution for treating pathological anxiety. Facts and trivia. The placebo works even if the patient knows it is a placebo. This is called open-label placebo. Clinical research has shown that even when the patient is told they are receiving a sugar tablet, their condition still improves. Sometimes, the expectation alone is sufficient. It is not even necessary to deceive the patient. The placebo causes physically measurable changes in the brain. PET scans reveal that the placebo releases endorphins, reduces activity in the pain center, and sometimes activates the exact same brain regions as genuine medications. This is not an imagined effect, but a neurochemical reaction. Expensive placebo works better than cheap placebo. In experiments, some subjects received a placebo perceived as expensive, while others received a cheaper one. The expensive one was more effective, even though both were the same sugar pill. Price perception literally modifies the effect. The placebo also works on animals. The placebo effect has also been demonstrated in animals, pigs, dogs, and monkeys, who do not understand that therapy is taking place, largely through the owner's behavior. The placebo operates within a social environment. Hope and care are intrinsically healing. Hypochondria is capable of generating real physical symptoms. This is not mere imagination. Heightened anxiety activates the sympathetic nervous system, which can trigger palpitations, chest pressure, gastrointestinal distress, sweating, and numbness. The body is capable of creating what the patient fears. MRI can detect that the hypochondriac brain works differently. In the brains of hypochondriac individuals, the fear center, the amygdala, is overactive, while the prefrontal cortex, responsible for rationality, is underactive during stress. This is not hysterics, but a distinct brain pattern. The nocebo can be stronger than the placebo. If someone is afraid or believes they have received something harmful, This can cause elevated blood pressure, sharp pain, or even allergy-like symptoms, solely due to the thought. Fear can elicit a stronger biological reaction than hope. Online self-diagnosis has drastically increased hypochondria. This phenomenon already has a name: cyberchondria. The reason is that there is too much information, and the search engine returns the most terrifying diagnoses for even the simplest symptom. The abundance of information paradoxically increases fear. The synthesis of the two poles. Hypochondria, or health anxiety, and the placebo effect are two closely interconnected sides of the intertwinement of mind and body. The process is not mystical but clearly founded on neurobiological and psychological mechanisms. The chronic fear is capable of generating and amplifying symptoms. This is the nocebo effect. In contrast, conscious expectation, belief, and trust are capable of endogenously mitigating these symptoms, which is the placebo effect. The improvement of our quality of life is up to us. Cognitive control, metacognitive awareness, and the recognition of anxiety patterns are key. As neurology also proves, fear and hope utilize the same neural pathways. It is only up to us which impulse we allow dominance in our brain. This ultimate control resides in the prefrontal cortex. Thank you for joining me today. If you are searching for answers, subscribe, turn on the notification bell, and share this with those who are not satisfied with superficial explanations. The light of reason truly shines when we pass it on.